Okay, so in this video we're going to go through some knee stretches along with some basic strengthening type exercises you can do to start to get the glutes and the quads, the thigh muscles working a bit better to help with your knee pain. Again, as we mentioned in other videos, it's important that you get a further assessment for these aches and pains that you might be having, just so we can tailor the exercises effectively. They aren't really a one-size-fits-all exercise really, so it's important to get that assessed further. When it's stretching, when it's a stretching exercise, you can hold that for about 30 seconds to a minute, again within your pain tolerance. Strengthening exercises that we'll go through, it's more about the repetition. If you're wanting to build muscle, looking to use some form of resistance to maybe 15 to 20 repetitions or to failure, and looking to maybe repeat that 2 or 3 times in a row. If it's more endurance, if you're running, you may want to do these exercises for more to fatigue, again maybe 3 or 4 sets, so it's probably a higher number, more body weight orientated for the endurance element. Okay, so to begin with, some knee stretches. Now hopefully, you know, depending on your condition, if it's a bit of arthritis in your knee, you may find this position's a bit easy to stretch the knee in, and if it's a cartilage problem, sometimes using a towel can help. But to begin with, just working into flexion and hold it for about 30 seconds to a minute. If that hurts or pinches at the end, because sometimes the cartilage disc, the meniscus, can get nipped, using a rolled up towel and just tucking that in behind the back of the knee and then pulling back can take that pain off and stop that impingement or that nipping in the back of the knee. It just pushes the tibia forward a bit. Extension stretches, sometimes you could just have it on a rolled up towel pushing down on your knee. You may also want to lie on your front and let your foot just fall to the floor off the edge of the bed. Again, just paying attention to how that feels in the back of your knee. And a good way to assess if you've got true flexion in your knee is, can you heel squat? So can you sit your heel, or does your heel touch your bottom basically, whilst going onto your toes a little bit, because that would be deemed truthful range of movement. Okay. Strengthening. To begin with, we'll look at some stability things around the glutes and the hip, because it does have a knock-on effect to the knee. So you can start by doing some glute exercises to activate your gluteus medius muscle. Again, you're just lifting that leg out, trying not to roll back, keeping that nice and straight. You can go into doing some bridging. We can then move into lunges, and again, knee in line with the middle of your foot or your sort of middle 2 toes. You don't want to be falling in like this, so if you're doing the lunges and you're finding you're coming in like this, that could be a foot or hip stability problem as well. So this is where the other assessment comes in really, and seeing a physiotherapist to decipher where your problem's coming from. And then you can do some single knee dips, again keeping your knee in line with the middle of your foot. With that, try and grip the floor with your foot as well. And if you want to make these things harder, you can use a weight. Repeat the same movements just by holding some resistance. And it doesn't have to be a weight. If you've not got that at home, you could put a backpack on, make yourself heavier. You could hold objects that you've got just lying around the house to make that resistance element a bit harder. Okay. So yeah, as we said earlier, they're fine to try as a starting point, but if you experience any pain, stop, and if you need any further input, please contact us via the information below.